Hi, guys. Wednesday's lesson of the day today. Sorry for being so late. It's 8:50 p.m. Worked till 6, ran downstairs, exercised really quickly, came back up and worked again, and then now I'm home. But there was an overwhelming theme today, which was just like insane how many people were talking about it, but it was about lower eyelid bags, but not the regular lower eyelid bags. So malar bags. And a lot of patients come through and always wonder about what to do with lower eyelid bags, but they don't really understand what's going on. And today it was overwhelming. There were a few, yawn, stitch by stitch design. Very excited about the upholstery that I'm seeing so far. Can't wait to send the car. So the overwhelming thing that I saw today was malar edema or under eye edema from filler that people didn't know was there. And this is very common. So first, I'll just go over the anatomy. There's 3 different types of eye bags that people see when they talk about eye bags. There's the actual eye bag, which is what I have, which are like these disgusting fat bags under the eye that look worse. Usually when you look down and when you lay on your back, they go away a little bit. So those are fat bags that are within the globe of the eye. So if you push on the eye, you see they pop out. That's the normal fat bag, and that's the fat bag that you treat usually with doing lower eyelid blepharoplasty or surgery, where you take the fat from there, transpose it down into the tear trough, and you get a smoother looking eyelid without the shadows. There's the skin, which is different. That doesn't really treat the bags. That just gets rid of excess skin if you cut some away. Or if there's wrinkles, you do a chemical peel or a laser for the wrinkles, not for the skin excess. Can I put your eggplant? Oh, well, okay. So, reading comments. The lower eyelid bags used to be treated with just getting rid of the fat, but now they do the fat repositioning. So that's that. If there's hollowing here, that's not a bag, but you can fix the hollowing a little bit with volume. Volume could be from filler, or it could be from fat grafting, or it could be from the fat repositioning. The other eyelid bag is called a festoon. A festoon is skin that gathers over here, and there are wet festoons and dry festoons. There are festoons that are just extra skin way down here that form because there's water accumulation in them, or some people just gather those. Those are excess skin, and you have to usually treat them with either radiofrequency, lasering, or by doing an excision, direct excision of the festoon down over here, because they're hard to get rid of. And it heals decently well in the right skin type. But you need to block some people? Yeah, I guess, but it's too funny right now. So the other type is what I saw today, and that's malar bags. So malar bags or malar edema is the other bag. So if you look on everyone's cheek, and you can see it on me, there's this little cleavage line right here in between this cheek and that cheek. And this is called the malar septum. The malar septum is a natural cleavage plane, just like the cleavage in your boobies, which means it dips in there and it's a separation between this cheek and that cheek. Separation of the fat pads, separation of the lymphatics. Lymphatics are the little channels that drain the fluid out of the eye all the way down. Ooh, Nayarit, very nice place. So fluid comes over here, goes all the way around and drains down. This is a basin over here. So it's like a bowl. And when your eye drains, it has to come around this basin and then go down in the face, back into the neck, back to the heart. So that's how it drains. This area drains directly down here or through the nose. So there are 2 separate areas. And what happens is, as you age, this part of the cheek comes down, the cleavage plane gets deeper, and you start to notice this bag more on some people, especially when they gather more fluid in the face. So who gathers more fluid in the face? Without any other surgery or filler or anything else, the people that gather the most fluid in the face there have allergies, they have high salt intake, they sleep flat, they drink alcohol before they sleep. These are lifestyle things that usually make those worse on some people, which is why they fluctuate and why they're worse some days than others, and worse some weeks than others, worse some seasons than others. So that's the malar bag. Malar bags do not get better with surgery. typically they get worse. So they get worse with surgery because you operate on them, and then the lymphatic drainage gets worse temporarily or permanently, and you have gathering more fluid. So if you do facelift, for example, and you have malar bags or malar edema, that's going to get worse temporarily for a few months until the lymphatic drainage starts to compose itself again, and then it starts to drain again. So those are the malar bags. So I saw a couple people today with malar bags, and I explained to them there's no great treatment for it, but there is a treatment once it gets bad enough. So once it gets bad enough, what you do, so if it's light malar bags, it's usually lifestyle changes. So you tell someone, listen, elevate the head of your bed when you sleep. Put an air filter next to your bed so you don't get the allergens irritating you as much. Don't lay flat when you sleep, as I said. Lower your salt intake. If you go have Chinese food, you're going to wake up with like really solid malar bags. And just other types of allergy prevention, less alcohol before sleeping, that kind of stuff. When you wake up, you can massage it out. So you do lymphatic drainage massage, and you actually grab it and you go out this way and massage. So it doesn't drain this way, it drains this way. So you have to massage out this way and down the face. And that's how you massage out malar edema. And you could do it with a jade roller if you want, and you get fart in your mouth. Okay, yeah. So if you put the jade roller in the freezer, then you can chill it, and it actually makes it a little bit better. Give me 1 second here. How do I do this? There you go. Okay, got rid of that guy. It was funny, but it's distracting. So, got rid of the fart in the mouth guy. So, either way, lymphatic drainage works. You can use jade roller or you can use rose quartz. Rose quartz are the pink ones, jade rollers are the green ones. Put it in the freezer and you could do it in the morning, or you can use your hand, which is actually a little bit better for some people because you can really firmly squeeze it out and drain everything down. So you're milking the fluid out of the eye. Now, the ones I saw today, you're blocking her. We can't assume it was a her. We don't know if it was a her or a him or the other gender things that we have now. We don't know. We can't assume. So back to this. The other thing that I saw today was people were coming in with exaggerated malar edema. Exaggerated malar edema occurs typically because somebody's had some product placed under the eye, and they all have different looks. So when someone comes in and it's really high over here and full and gray and kind of round, that is usually Juvederm that was placed in the under eye. On occasion, it's less exaggerated because Juvederm does not belong in the under eye. It draws in 6 times its weight in water. It does not belong in the under eye. It blocks the lymphatics. It gathers water. It makes it gray. It reflects a crystalline color. It looks terrible. Some people would call it a Tyndall effect, even though it's not bluish Tyndall, but you can call it whatever you want. Other people get it even when they had proper under eye filler, and the proper under eye filler, which is the best one for the under eye, is Restylane L. Stays in there sometimes for 1 year. It can stay there for 10 years. Let's say it stays there for 10 years. Year 1, maybe it was Restylane. Year 2, still Restylane. Year 3, still Restylane. Year 4, it's decomposing and it's coming apart, and the cross-linking of the hyaluronic acid changes, and the characteristics of the filler can change. So then it becomes something else. It can become Restylane L 5 years later. It's different. So when it changes the hi Daniel Durhey, and when it changes the characteristics, it can start to become superficial. It can clog lymphatics. It can draw in water. It can do all that kind of stuff. So that's what happens to Restylane years later. Sometimes you don't notice that. Sometimes it's 10 years. It sticks around, and all the volume is there, so it changes character. Whatever. Then you have the characteristic that everything is boggy and gray and puffy. That happens for 2 reasons. So one of the reasons is because of fat grafting, and you ask the patient, did you have fat grafting? Half the time they say yes, half the time they say no. People who've had fat grafting don't always remember that they had fat grafting. This is common, and it's because they had other stuff done and they don't know where the doctor placed it always. They forget. So that's one reason, is that they had too much fat grafting, low and superficial, and the low fat graft clogged lymphatics. The superficial fat graft is pushing up against the eye, and it hypertrophies and thickens and grows over time. So that's another reason people can get worsening malar bags. The magic one that I saw today a few times was radius. Radius is what I assume was in the eye. I didn't know for sure. I'm assuming. Ask of you and me, but I told them I'm assuming just because I've seen it before. That's what it looks like. When radius goes to the under eye, whether it's dilute, hyperdilute, or regular radius causes problems. Radius is a calcium hydroxyapatite paste, which means it's a bony mineral. And when you put it in the under eye, it forms little crystals that draw in water, stick to the muscle, stick to the fat, and they cause problems usually for life. So if you ever put radius in the under eye, realize it might do that for life. And it doesn't matter what you do to it. If you mix it with another filler, if you mix it, the idea that people have is that it produces collagen. That's why they put it. Those people have a very strong imagination. When you put radius or Sculptra in the face and you're telling people it forms collagen, you are misleading them a bit, because what people think about is that collagen's healthy and that we have collagen in the skin and we're replacing collagen that was lost with age. The reality of it is that you're putting in an irritant that's pissing off the area and forming scar tissue collagen. That's like telling someone, and you can ask them, say, hey, would you like a keloid in your face? And if you ask them that way, they say, no, but why would you ask that? Well, keloid is full of collagen. It's lots of collagen. It's actually the purest form of collagen. Would you like a keloid in your face? It's a collagen tumor. Would you like a collagen tumor? And they'll probably tell you no. So collagen is not always good, but people put it with the assumption that collagen is great no matter what. So they put it in the under eye and they think, okay, it's going to form collagen. And it will, but it'll do it in a really nasty way. And these people get a grayish discoloration that goes all the way across, and just it looks wet all the time, but it doesn't look as normal as just a regular malar bag. It looks a little weird and it looks more medial. So that's the difference. If it's just a malar bag, it's out here. If the puffiness is out here plus goes all the way across, that means that now the malar bag has added to a regular under eye bag. And see, injecting radius in the under eye is malpractice. I would agree. It's a very, very bad thing. So it travels all the way across, and now you have this medialized bag. And when you see those people, they just look wet there. And usually you'll ask them, have you had filler before? They said, nah. I'm like, well, this is not natural. He goes, well, one time, maybe years ago, but I had it dissolved. And so they're telling you, not that they haven't had filler before, they're skipping to the part where they just say, well, I had it dissolved, so it's impossible that filler's there, so don't even ask me. Realistically, the filler is still there, whether it was Juvederm, Radius, anything, and the dissolver didn't work. Dissolver doesn't work on Radius. Dissolver works weakly on Voluma when it's under the eye because it's a stickier linear filler and it takes more dissolver sessions. So you have to look at these people and wonder or ask, how many times have you been dissolved? If they say I've been dissolved 5 times and every time I got dissolved it got better, then got worse again after 2 weeks, you can say, listen, are you sure you didn't have Radius? Because that sounds like Radius. And they might say, you know what, maybe one time I had it in the cheek, but that was years ago, it's not there anymore. And I'm like, who told you it's not there anymore? So this stuff can last forever. It can last 10 years, it can last 20 years. Once it crystallizes and touches soft tissue, those calcium crystals fibrose and they stay there. They don't go away. To get rid of them, you have to physically cut them out, but you can't do that because they're attached to function power. So the other option is trying to inject it with sodium thiosulfate, which theoretically will acidify and break apart the calcium crystals, but nobody knows if that works for sure or consistently or anything. So these patients with the malar edema, I referred them to 2 doctors in the area, and there is one doctor, Jonathan Honig, who's amazing, and then Kami Parsa. And I wouldn't refer them if nothing could be done in the case of Radius. It's because I don't know what else is in there, and these 2 guys are very good at looking at the eye and trying to figure out what's going on. I like to refer to Kami Parsa because he deals a lot with changes in the under eye over time, and he does ultrasound to see what's there. So sometimes you can see if there's a calcification or something. And I refer to Jonathan Honig because he is a mix of an oculoplastic surgeon and a facial plastic surgeon, and he's got a lot of experience also with radio frequency, with CO2, and other things that can shrink down the malar bags. So malar bags, the thing that I was saying was you usually treat it with a lifestyle change. If it becomes bad enough, then you have to scar the area down internally to try to get it not to gather fluid. So you have to look at this area like a sponge, and you can actually dry out the sponge in a way that it can't retain water anymore. And that's done in different ways. One of them is you put an irritant in there like doxycycline, which is an antibiotic that causes scarring or sclerosis. That's not as controllable. And then the other is by doing, is Anil Shah any good? Yeah, yes. And the other is by doing radio frequency with or without CO2, and you usually do several sessions in the right patient, and it can scar the area down to make it less bad. Originally, when they were using Fractora, the success rates were about 50%, which people are like, that doesn't sound very good. It's great in a treatment that otherwise is like, or in a problem that's otherwise impossible to treat. So 50% is not bad, but now the success rate is probably higher with all this other stuff. So the other type of look I saw today was from a patient that I had before, and she was following up for her lip lift, and she had this bumpiness in the under eye, which didn't look like the others. So I asked her, have you ever had Sculptra in the under eye? That looks a little, or fat grafting, or Sculptra and fat grafting. And she said, yes, I've had Sculptra in the under eye, multiple needle injections, and I felt it, and she's got nodules all over there. So those nodules are very difficult to treat, and those things you can't get rid of. So Sculptra and Radius, this is a different conversation I had. They are irritants that we use in the face sometimes. Radius has no real benefit over the other fillers for any area. People think it does because it's a bony mineral. They think it lasts longer. Realistically, it doesn't last much longer at all, and you can't dissolve it. It can spread a little more easily because it's a soft paste. So I don't even know why people use Radius, but fine if they want to use it. Here is what I want to explain about Radius and Sculptra. Radius and Sculptra, when used for collagen formation, it's a bit misleading when people, and I've said this before, but I want to repeat it. It's a bit misleading when people say it forms collagen, because that makes people feel comfortable that it forms healthy collagen. So I want to make sure people know this. It does not replace collagen that we've lost with age in the skin, which is what you think it does, which is what lasers might do, which is what microneedling sometimes might do, which is what radiofrequency might do. What it does is it replaces fat that was lost in the face with scar tissue. That's how you have to look at these things when you're using them properly. So not Radius, but more Sculptra. So Sculptra is good for gaunt faces when you're losing weight and you're super thin and you have no fat to transfer to the face. Sculptra is more predictable because you can put it around everywhere and it'll form bulk in there in the fat layer. That's a great use of Sculptra. In the temples, if they're really hollow and you go down into the fat pad that's on this anterior portion and you inject deep Sculptra, that's a good use of Sculptra. You're building up the bulk. Putting it directly under the skin to add collagen in that area is not a great thing to do because it will change the skin turgor. It'll make the skin in some people calcified, some people a little nodular, some people will get bumps. Not everyone, so I'm not saying everyone, but why would I take that risk? I'd rather do another kind of treatment for it. Another place that it's used is here for horizontal rhytids. They use hyperdilute Radius or hyperdilute Sculptra. It's not going to cause a problem in everyone, and if you go crazy dilute, it's probably fine. But every once in a while, it's going to cause a nodule on someone. And it's an acceptable risk if there's no other option, but I say there's probably other options. So when we're doing these lines in the neck, you can use dilute hyaluronic acid filler and some Botox, and at least in my hands, it gets the same results. Maybe I'm bad at doing it the other way, I don't know, but it gets the same results, and you can always do radio frequency to tighten it up. So that's that. Lesson of that is people don't generally remember what they've had in the under eye. Every single person I asked today, and I know they had filler in the under eye because I'm staring at it, told me they'd never had filler. I had to really get into a discussion to get them to tell me that they had filler. So this is a lesson for the doctors. Just because a patient says something doesn't mean it's correct. I think it's freezing. Okay, many times they're under the false impression that filler goes away in 1 or 2 years, or they had it dissolved, so they're giving you the information they think is correct, which is, no, it's not there. Please don't consider it. Patients shouldn't get that involved. They should just give us the information, let us figure it out. That's the easiest way to do it. But every patient does that. It's normal. I'm used to it, and I still go through the process of, are you sure? Are you sure? Every time. So that's the difference between the eyelid bags. I gotta run. Hope everyone has a good night. And yes, I will save this video and post it.